Welcome to the Afterspin, opinions from thought leaders in our state. I want to ask Mary Margaret Peg O'Connell and Patrick Sebastian. As of the first of this month, a CMS federal policy requires hospitals to post their standard charges for medical procedures, supplies, tests, even services. Now, State Treasurer Dale Folwell has insisted also that these providers list their charges made for particularly the people that are covered by the state health plan. Hospitals and providers say this isn't the actual amount the hospital receives because of negotiated prices with health insurers and set amounts that Medicaid and Medicare will pay from the federal government. Everybody says they want to take the cost out of health care. What do you think about this new federal requirement, Peg?
Well, you know, Tom, I'm generally for anything that will give consumers more information to make an informed choice. So having some of this information put on a website is a good thing. The problem with what is up there right now is it's such a massive amount of information. I don't know that anybody can really use it very well. And charges are one thing. You're right. The difference between what the charge is and what somebody or their insurer ends up paying is totally different. And I think cost isn't the only driver in healthcare. Quality is a very big deal. I mean, you could pay 10 cents for some service at a local hospital, but if you die from it, that's not really a very good thing. So I think that combining, and this is a part of a move toward transparency that will actually eventually give a bigger picture to consumers on what they are buying. On the as Treasurer Folwell's issue, you know, I know he wants to save money. I think his fight is not with the hospitals, and I've said this before on other episodes of this program. It's really with Blue Cross Blue Shield. He needs to get square with them. And in all honesty, the most recent study says 17% of the people in the state employees health plan drive 80% of the costs. So what the state employees health plan needs to do is go back and start focusing on value-based purchasing and prevention, which they were state of the art until recent years.
Interesting comments. Thank you. Patrick, everybody, Peg's right. Everybody wants to talk about taking money out of the healthcare system because all of us say it's costing too much. What do you think of this federal reg?
Well, I have immense respect for Treasurer Folwell. He did a phenomenal job helping reduce the debt burden that North Carolina had when he was at the, I think it was the Unemployment Security Commission. I disagree with the approach on this situation for a couple of reasons. One is the Treasurer's Office signed the contract with these insurance companies to make this whole thing happen in the first place. And I don't know about, I think most people, when they sign a contract, they get to demand to know what's in that contract when they sign it. So it's a little baffling to me is, did someone sign a contract in the Treasurer's Office and not know what was in the contract? That to me is strange. And maybe there is information they don't have it seen yet. I don't know. It's just bizarre to me that they would not know what they signed. The second thing is, when you start talking about what they're talking about from the Treasurer's Office, it's going to remove money, like you said, from the health care plan, and when you start taking disbursements away, which will be several $billions, that doesn't hurt necessarily just any hospital, because look, Rex, Wake Med and Raleigh, Presbyterian,
UNC, yeah.
Those hospitals do very well. Not that they wouldn't be hurt, but those hospitals do very well. What it would hurt is our rural hospitals that are already struggling. You look at northeastern North Carolina or the far west part of the state. Or,
I've heard 5 are teetering on the throes of bankruptcy right now.
And people aren't, if you take away a big portion of their disbursements, people aren't going to have health care. And look at eastern North Carolina. You have Vidant there in Greenville, and without Vidant in Greenville, the eastern part of the state is going to be very poorly served. Not that it's going to go extinct, but the problem is these rural hospitals, they cannot afford to have money taken away from them because it's going to hurt not just state employees, it's going to hurt the average North Carolinian.
As with so many of the issues we discuss, it's complicated.
It is.
It is complicated.
Well, I want to say this. I agree with Patrick, which might be the only time we ever say that.
Well, both of you made, I think, some very cogent comments.
I think the treasurer, by the way, I think he means well. But I just don't think this is I think this is a wrong-headed direction to go.
Oh, we're going to hear from Dale about this. You can be sure.
I'm glad he said that.
Well, thanks for watching the Afterspin. We'll have more video all during the week on ncspin.com.